Okay, here we see in the bladder neck the leukoplakia areas and all the trigon. We have these some islands of leukoplakia, patchy tissues, abnormal tissues, different than this normal bladder wall. This is a normal bladder wall. This is the leukoplakia areas. And this is the ill part. Look at this part. The bladder epithelium is going off. When I scrape the tissue, it's very ill. There's membranes formed. When urine acid is touching to these tissues, they make too much irritation. Look at these membranes. Tissues are coming off when I just scrape them and they bleed. This part, I want this part to be like this, but I want the other bladder walls to be totally healthy. And now we will control. These are leukoplakia, very ill trigon. And then I look to other bladder walls. We don't have any bleeding yet, and it seems quite large capacity. If the bladder walls are all healthy, there will be no problem. We are doing cystoscopy to see all of the bladder. Here, there may be a little membranous formation in the bladder wall. Look, this part seems a little unhealthy. A membrane is formed over the tissues. I can scrape them. So these are very sensitive to urine touch. This is a dirty tissues. So the next step is interstitial cystitis-like syndromes. So these membranes always cause too much irritation and inflammation. Look, when I scrape these tissues, this is whitish, this is more yellowish. Here this is better, but here these parts, they become to be infected. Okay, I will make spots of fulgurations there. I am sure when I empty the bladder, these sites will begin to bleed. Now I will empty and see. This is what I see, what I mean with the fragile bladder. Now I am emptying and you see the bleeding begin. So this kind of bladders needs more time to heal completely. You see the bleedings here. There is a more reddish part. This may be the part that comes into contact with the trigon. So I will mark here to make a fulguration there. Not to forget. And the other side wall. Okay, still here also, when I look this, I see a dirty appearance in these tissues. And when I scrape, look, there is a membrane covering the tissues. So previously, I had nothing to do with these kind of bladders, but nowadays, I will make some spot fulgurations here to stimulate the tissue healing. Very fragile bladder wall, very thin and different in color. And when I look at these membranes, the epithelium of the bladder has changed. So what's the solution? All of them. So you see the epithelium is very ill. So the treatment will be a little longer treatment course. Always the beauty look at these bleedings here. Okay, this is because I scraped these parts. And here, the first part I do scrape. There's not too much bleeding. I am scraping these tissues to let new bladder mucosa formation. I am now emptying the bladder, and we see the spots of bleedings in the fragile bladder wall. And this part, you see, it's not extreme, but it is significant. So look at this part. Bladder wall is bleeding.
Okay.
Okay, we emptied the bladder and see that there are really significant bleedings, and that means the bladder wall is a little fragile. But it is, I don't want to say it's extreme. I have still hopes that we can help. I know there are still some membranes in this bladder, but okay. Now we see the really inflamed cells. Here I will make a fulguration. I mark this part, but when I now look at this is not in contact with trigon. This is in contact with this part. Maybe they are touching to each other and making inflammation. Anyways, first my first suspicious place is trigon. I will treat that part first, then rest of the bladder. It's bleeding more compared to other patients, but still, I know we will help this lady. This is, I think it's an intermediate stage between interstitial cystitis and chronic cystitis. I am sure some of the interstitial cystitis patients change to this situation from chronic cystitis. When the inflammation is extreme, it passes to the next level from chronic cystitis and they become interstitial cystitis. For some of the interstitial cystitis, I am sure about it. But there may be other reasons too. So, I am now fulgurating these secondary. Sometimes I do deeper, sometimes more superficial. It's all related to appearance and my experience. All these parts need to be fulgurated. This may be the border. Here is the trigone. This is the border. These tissues seem healthy. This is right ureteric orifice. Till this part it seems healthy. But here there is trigonitis. This part is healthy, this part is trigonitis. The white parts are healthy. But after trigone, I will fulgurate these bleeding parts. I will make some spots of fulgurations like this to make some spots. Okay, this is my border, orifice, bleeding parts. Still we need some spots there. All inflamed tissue, and this thickness seems to be enough. Well, here is the orifice. bladder neck. It is important. You don't want to leave any tissue behind, and sometimes it is difficult to make a decision. I can't go too far in the recurrent, still I don't have to leave any tissue behind. This is my border here. This is a normal tissue. Urine is coming from right kidney. Okay, seems quite good now. Upper part. There are some polyps which all caused by chronic inflammations. I had to destroy them. Look at these polyps. I usually see them in extreme cases, difficult cases. These are difficult to see. I don't know what will happen if we miss them. I don't want to miss any infected tissue behind. And this is the border. If I come very this way too much, we will interfere with the urinary sphincter. Okay, bladder looks better now. It didn't continue bleeding too much. But mucosa is very thin. I can see the vessels outside the bladder. I don't know if you can see this blue image underneath the mucosa. This is the vessel outside the bladder. The bladder wall is very thin. I can see the outside vessels. And I will do some spots of fulgurations in these unhealthy tissues. Why I do this? Because we know that when we fulgurate some part, the newly formed mucosa is a little different than the original one, and it's proven that it's more resistant to infections, and because it has more vessels inside. Of course, this is another theory of mine, which is not proven as usual, which is not done by others as usual. So these are all my experience. I will not do it here. This is the normal mucosa, but here the bladder, which is bleeded, I know it's not harmful just with my experience. Okay, the trigon is quite good. There are some blood clots here. This part, for example, we have a little more than normal mucosal tears, and this is normal part. We may need it here, also here, but mostly it is the opposite walls. Look at this part. We will definitely need some mucosal healings over there. Okay, now I've finished. The trigon is okay. There were significant trigonitis and leukoplakia in the bladder neck, and the bladder walls were more fragile than I expected, but it was normal. This lady has too long a disease period, and as I said, I'm making some spots of fulgurations to these areas, and I'm trying to improve the formation of new tissues. So I made a couple of them to these places, and now it's not bleeding. This is a good sign, and her bladder capacity is good. This is also a good sign. Yes, we will see and wait and see with the healing time. Okay. Okay, there are a lot of discharge in the vagina. Cystum. We are cleaning them. And the cervix seems completely healthy. This is good. Let me see it. Şu bacak kafasını. Önce ben görün sonra başlarım. Okay, here, this is cervix uterus. It seems completely healthy, no inflammation, nothing. There is a synechiae, maybe from some stitch, maybe something, but it seems healthy, no problems. But there was a little more than normal vaginal discharge. We cleaned them. Otherwise, vagina is normal.